I hope everybody had wonderful holidays. And while we were gone, there have been a couple of developments that I want to talk to you about. The first one is somewhat controversial, as I'm sure you've all been hearing. CDC has updated their guidance with regard to isolation and quarantine. And if we remember, isolation is for people who have COVID symptoms and/or have had a positive test, whereas quarantine is for someone who's had an exposure, but doesn't have symptoms or doesn't have a positive test. So basically what CDC is doing is shortening our time periods. And again, this is controversial. So I'll start off by saying these are just recommendations. And I think for the most part, as employers, we've wanted to follow CDC recommendations and CDC guidance throughout the pandemic. But if you feel that this is unworkable, if you feel that this is gives too much leeway for employees, you may want to have something a little bit more stringent in your policy. It's something I think about case by case basis, something I think about with regard to your particular workplace and what your needs might be. But this is what we currently have. So this is isolation. This is for people who have symptoms, so you're pretty sure they have COVID and/or they've had a positive test. That's now isolation for 5 days. If they're asymptomatic or their symptoms are resolving. Symptoms are resolving means no fever for 24 hours, and that's without fever-reducing medications. So you've only got that isolation for 5 days. Follow that by 5 days of mask wearing. Okay. To calculate the 5-day isolation period, we've gotten this question a few times. Day 0 is the day that symptoms begin. Day 1 is the first full day after symptoms develop. So that's how you're counting your time. And then with regard to quarantine, a lot more information here, obviously. I won't read all of this for you, but you guys will get the slides after today. So if you're unvaccinated, it's been more than 6 months since your last vaccine and you're not boosted, it's 5 days of quarantine followed by 5 days of strict mask use. If you have to quarantine, again, day 0 is the day of initial exposure. Day 1 is the day after that first exposure. And this is part of the controversial piece. If a 5-day quarantine is not feasible, imperative that you wear a well-fitting mask for 10 days. So this may be the piece that employers don't want to follow, that you want to say, no, we're not going to do that. We're going to make sure that people quarantine. If you've gotten your booster shot, you don't have to quarantine at all. You should wear a mask for 10 days after exposure. And again, you as an employer, especially if you're in a situation where your employees can work from home, you may just want to say, hey, work from home for the next 5 days, the next 10 days. Even if you've been boosted, even if you've been vaccinated, we want to make everybody as safe as possible. Best practice is a test 5 days after exposure. If you start developing symptoms, then you start quarantining again until you have a negative test. Now, I'm going to talk about testing because it's getting harder and harder to access testing, and I'm going to talk about that in a minute. All right, so that's what's going on with the CDC update with regard to quarantine and isolation. Also wanted to give a quick update on the OSHA ETS. As you recall, this is the emergency temporary standard intended to apply to employers with 100 or more employees. It's a vaccine or test standard. Originally, this was stayed by the U.S. Fifth Circuit Court of Appeals. The Sixth Circuit dissolved that stay. And now there's been an appeal to the Supreme Court. My understanding is that on January 7th, the Supreme Court is going to hear arguments on this. So I imagine we will have an answer from the Supreme Court fairly soon, but it may not be before the January 10th deadline that OSHA has set. And this is the statement that, at least as of late yesterday, was still on OSHA's website, that they've reset their deadlines to January 10th and February 9th. So again, it puts employers in kind of a difficult spot. We don't know exactly what's going to happen with the Supreme Court. We don't know if the OSHA rule is going to stay in effect, is going to get reversed. So you just need to be as prepared as you can as an employer for whatever might come down the pike. We have a complete list. I didn't want to relist everything, especially since we don't know what's going to happen with the ETS, but you can go back on the website from the November 9th, 2021 town hall. We have much more detail in our slides if you wanted to take a look at those. But basically the idea behind the ETS is first knowing who's vaccinated. And you guys, I've been talking about this ever since the vaccines came out. I think it's a good idea to know who's vaccinated and whether this ETS goes into effect or not. I think the gold standard is getting vaccination cards. Remember that they are a medical or considered a medical document, so you want to keep them separate from personnel files. You want to keep them as you would keep any other medical documentation, but I think it's a really good idea to know who's vaccinated. Assuming the ETS goes through, employers are going to be, and this is large employers, 100 or more employees, are going to need to provide 4 hours of paid time above and beyond PTO to receive vaccination doses, and then a reasonable time of paid sick leave to recover. OSHA has said, and we never really heard FFCRA or otherwise what was a reasonable amount of time to recover from vaccination side effects, but OSHA is saying that's 2 days. And then this is really kind of the big one, as far as employees who are not vaccinated or wearing a face covering when they're working around other people, and then developing, implementing, and enforcing that mandatory COVID vaccine policy. It's either vaccinate or test, okay? One of the big issues that's coming up right now is how are we going to test people if we can't get access to tests? And OSHA, as far as I can tell, has not given an answer to this. I think it's definitely a do the best you can kind of situation. It may very well be that you want to, as an employer, try to get your hands on home tests. And my understanding is that there is some availability there online and at local pharmacies, but you got to find them, and you've got to find them in bulk. So it may be that you want to go that route. It's a good idea to have them on hand, whether the CTS ultimately goes through or not, I think. But again, OSHA has not given us a good answer to what to do in light of testing shortages. I will say this, if you're not in a mandatory testing situation due to the ETS, you probably don't, as an employer, want to require your employees to get tested right now, certainly not to return to work. Medical personnel are telling us that you can test positive for weeks after you have COVID. So getting a negative test is not always the most accurate way to know if somebody's ready to come back to work. It really is more about being symptom-free, having symptoms resolve and being fever-free without fever-reducing medications. But it is something to be thinking about as an employer. We've got to be practical with all the testing shortages that are going on. And then also we've got the federal contractor vaccine mandate. That also is under appeal right now. It is sitting with the 11th Circuit, and based on what I've read, based on the briefing schedule, we're not going to have a response on that or an answer on that until late January. So if you're a federal government contractor and you're waiting to see what happens with that, hopefully by the end of the month. And then just sort of overall, I read this morning that Montgomery County, Pennsylvania, which is where MEA's offices are, we've got a 20% positivity rating right now, as far as people who are getting tested, 20% are testing positive. And that's, higher than it's been certainly for a very long time. So cases continue to rise. Employers who had thought about coming back to the office in January are in many cases putting that on hold. We've gotten a lot of questions on hotline. What about requiring the booster? You certainly can make that decision as an employer. CDC has not changed the definition of fully vaccinated. It may. Right now, fully vaccinated is 1 dose of J&J or 2 doses of Moderna or Pfizer. At this point, like I said, CDC has not changed that definition, but it may very well be that that happens. And you certainly, as an employer, can make that decision. We're going to require the booster, and maybe just require the booster to come to the office, require the booster if you're interacting with the public, all those things to think about. And of course, what you're always weighing as an employer is, on the one hand, I've got employee safety. I've got employees who have medical conditions that make them more susceptible to serious COVID symptoms. So we're trying to keep everybody safe on the one hand, and on the other hand, we've got that core group of employees who don't want to get vaccinated, who don't want to be told what to do. And if we require the vaccine, if we require the booster, are those people going to leave? And that's amidst staffing shortages all over the place. So it's certainly something to think about. Think about your risk on both sides and think about what works best for your business. In general, we're hearing about the courts not always upholding these government vaccine mandates. In general, private vaccine mandates have been upheld. So even if you ultimately get challenged, not that I want to see anybody have to go through that court battle, but that's probably going to be upheld, and it's probably going to turn out okay. I was just reading this morning about Starbucks putting in something. I haven't read the details, but I think that they're doing a vaccine or test, and they're making employees pay for the testing. So employers certainly are doing this, and they're doing it at risk of losing people who may quit because they don't like the mandates, but certainly something to think about. All right, Kevin, do we have questions?
I had a couple of questions. One is, should we, and I think you've kind of answered it, is should people start to keep track of boosters? Again, I think based on the most recent from the CDC, there is a difference in terms of the quarantine requirements. You'd want to, if you want to follow that, you'd want to have the booster on file. But, you know, like I said, I think in the future, the booster is going to be one of the conditions of being fully vaccinated. So it doesn't, you know, if people have given you their vaccine status already, I don't think they're going to object to giving you the booster status.
Yeah, I would just go ahead and say, hey, you know, we're using the booster is part of the decision-making process now with regard to quarantine and isolation. So if you've got it, we'd love to hear it because it's going to make the lives of those people easier. So yeah, I would get it.
I think some people are asking, again, I'm assuming this is under the ETS, what's the best way to get the vaccination cards? You know, is it email? Is it a portal? And then also, do they need to obtain cards if an employee is 100% virtual?
So I would still get the cards if someone's 100% virtual because you never know. But that answers that question. I think it is more complicated. If you're a small employer, I think it's very easy to get the vaccines to get the cards through email. But I've been talking to some employers, you know, some employees don't have access to email. You're a large employer, you've got hundreds of employees, and maybe it's not the most efficient way to get it through, to get the vaccine cards through email. So we've had a lot of questions about doing it through your HR portal. The biggest issue there is confidentiality. Who has access to the portal? You want to make sure, you know, think about your portal just like you think about a locked cabinet in an HR office. You know, you just want to make sure that only HR has access to that information. So whatever works best for your office. If you're a small office, yeah, emails works fine, but I understand that doesn't work in every office.
And again, that doesn't mean as HR that you can inform a manager as to who has to wear a mask, because that's not disclosing vaccine status. That's just saying based on our procedures, this is, you know, who in your staff is required to wear a mask. So I think that's, you know, it's important we distinguish the record keeping from the process you're going to create. Right. Someone asked a question of, with respect to employee privacy, would there be any restrictions against holding a meeting of unvaccinated to talk about the testing mandate? So limiting an audience to those that you don't have vaccination records on.
That's an interesting question.
Yeah.
I mean, I think the way that I've couched it all along, because all of this stuff creates some really interesting practical questions, just like that one. But the way I've always couched it is we're not differentiating you between vaccinated and unvaccinated. We're differentiating you between people who have provided proof of vaccination and people who have not. So we're calling the people to a meeting. So I theoretically, I think you could call people to a meeting who have not provided proof of vaccination. And I don't think that is a privacy issue.
Yeah, and I think you're saying we have to institute a testing procedure with, you know, individuals. So we're gonna have a meeting about that. Yeah, I think I would think legally that'd be okay. And someone said, you know, testing sites, how do we get our employees tested? Test kits are not available readily. I think, again, I think if you have employees in this case, you probably need to start looking online for sources of testing sites. There are some bulk providers, whether they still have capacity, I don't know. You could also talk to your benefits provider. They might have some access to some other sites as well.
I would go ahead and get the at-home kits. Keep in mind that if you're going to do at home, somebody needs to observe, you know, someone swabbing and or the results. You don't want to completely distrust your employees on that. But yeah, the testing sites are overwhelmed. I've heard a lot of stories over the last couple of weeks of people waiting hours and hours to get tests. So I don't think that's the way you want to go at this point.
And someone asked if you're in a state, have a plant in a state covered by ETS that has different state laws. I believe that's what the Supreme Court's addressing, is the federal preemption. So that would get resolved by the Supreme Court.
Yeah, should.
All right. Well, welcome back. It was a good way to start us off. And next week, we'll give Amy the time to go through in detail all the different procedures, so we kind of accumulate everything together again, and also to let everyone know about all the new and exciting resources we available through the technology platform we've developed. So thank you for joining us. Hope everyone's doing well. We have one more question here. If we're allowing employees to test in lieu of vaccination, must they test within 72 days? I don't know the answer to that.
I don't think
I thought it was a
understand the
weekly
question.
test requirement. So.
It would be a weekly test requirement. Yeah.
So, all right. Well, enjoy everyone and stay safe and healthy. Take care. Thanks, Margaret and Amy.